As more Jamaicans are relying on our healthcare system, we recognize that there is much to be done to improve our health infrastructure and our customer relations.
From April 1, 2018 to March 31, 2019, government will be running a health bill of more than $68 billion. Most of the money is to pay for pharmaceutical and medical supplies and to repair and maintain the physical plant, equipment and furniture of health facilities through the 4 regional health authorities. Vital resources will also be pumped into the blood transfusion services, the National Family Planning Board, and interventions for drug abuse prevention and control.
The National Council on Drug Abuse started its marijuana public education campaign in July, and this will run for at least 1 year. This is aimed at discouraging our young people from smoking marijuana.
The Ministry of Health is also contributing to the operating costs of the University Hospital of the West Indies, and a healthy-sized allocation is designed to maintain first-world competence of Jamaica's health practitioners through training.
We're taking active steps to ensure that you visit our facilities, you're comfortable with the physical plant, and that you're treated with the respect and dignity that you deserve.
From its own coffers and with the support of Jamaica's bilateral and multilateral partners, government will be commencing or continuing 5 health development projects in the new financial year. 2 of them provide intervention to reduce HIV infection rates, end discrimination, and cover treatment and counseling for infected persons.
Remember, prevention is always better than cure.
To ensure that mothers and their newborns have the best shot at a long, healthy life is a continuous concern for the government. Providing more and better designed and equipped neonatal high-dependency units manned by well-trained health professionals is the plan for this year. Another plan, funding preliminary works for the construction of a children's hospital in Western Jamaica, which will be built with grant funding from the Chinese government. And the National Health Fund is set to contribute $1.96 billion for a health services improvement project that tackles everything from mental health to vector control, sewage treatment, diagnostic services, and more.
Let us redouble our efforts to live healthier lives so that we can be more productive and enjoy more moments, more memories, more life.
In financial year 2018-2019 and beyond.